News.
And here to talk about that and much more, Congressman Steve Cohen of Memphis. Congressman, you and your colleagues on summer break right now, but so many different issues going on, including what we just reported involving the recent ICE raids in Memphis and across parts of Shelby County. You've essentially written a letter to ICE expressing your concerns. Why so?
Well, the policy of the Obama administration, and allegedly the policy of this administration too, was going to be to prioritize arrests to the manpower we have available and the resources, which is limited, to those immigrants who had committed criminal acts and deport them. And that's what Obama did, and he did it in great numbers, to be honest. And that's what we thought this administration would do. But then the administration changed, Jeff Sessions, and they said they would do that. But if there were people they came in contact with when they were conducting such raids who were illegal immigrants, didn't mean that they would not be arrested. Well, in this series of raids in New Orleans and Memphis and another city here in the Delta area, I think about 80% of the people were not committed a crime. So that's just not a good use of our power and of ICE. And I asked, what is your criteria, and who was arrested?
There are those who will say, though, that they are committing a crime just by not getting legal. And then there are others who say we make it so complicated to get legal. Can we not simplify that process and thus give the path to legal citizenship a boost?
Well, we could, but we're not gonna. There was an effort, bipartisan.
Why didn't we during the Obama administration, though?
Because it takes two sides. It takes a majority of Congress, and the Republicans have to come along. And there was a bipartisan committee that was working together to try to do that. And then the Republicans on the committee, at least two of them, dropped off. And then eventually there was just down to where there were 3 Republicans that would support it. Yeah.
Congressman, also talk to us about the future of health care insurance in this country. Where do you think we're headed now? Will there be a bipartisan plan after efforts that we saw failed in the Senate recently? Will there be bipartisan plans to maybe fix and repair Obamacare, or do we start from scratch?
That's what we need. We need to fix it, and that's giving more support for the insurance industry that provide the subsidies and where individuals have to pay high deductibles or high copays, and to help with the insurance companies. And where there are high risk corridors where the people have more likely to have pre-existing conditions and expensive care, to give them more money, kind of a reinsurance plan. Lamar Alexander has said he's going to work with Patty Murray in the Senate, and there's a group of about 40 in the House, a group pretty much the more liberal, which are moderate Republicans, and the more moderate, which are blue dogs, sort of, or new Dems, Dems getting together, and they've got a proposal, and I'll support their proposal if they can get it to the floor. I'll be happy to support it, because we need to make sure that we have insurance and for people. And this, what we've got, the Affordable Care Act's a good act, but it's not the perfect act. We ought to have a single payer system that would eliminate the profits of the insurance companies, advertising, and all those other things, and we could get down to getting health care directly to the people.
Because, like you said, even the biggest fans of the Affordable Care Act admit it does have its share of problems.
Well, it does. It was a Republican plan kind of created by the Heritage Foundation, a very conservative group that Mitt Romney used in Massachusetts. And for whatever reason, that's where we started. Maybe it's because that's all we could pass. And we did that. But I think we do need to have, eventually, I think I'd like to go there, but if in the interim, a public option, that would be a way to keep costs down. We need high-risk corridors. We need the supplemental pay that the insurance companies put out for individuals. We need a policy where we negotiate for drug prices to keep them lower. There's a lot of areas where we can make change.
And Senator Sanders, who of course ran his presidential campaign pretty much on that message, that was the central message, brought that back up, the idea of a single payer or at least a public option within the ACA, so those people who don't really have a choice can do it. But is that realistic? I mean, on one hand, you can say, well, Medicare has worked for years. Why can't we do Medicare for all? What would you say to those folks who say Medicare doesn't work? We just don't want it. The government should not be in our health care.
I don't know anybody that says Medicare doesn't work, really. I mean,
some of my Facebook friends do.
Well, there's
the VA, for instance. They pull that up.
The VA is different, and the VA. Some people say it works. I was at the NAMI meeting last night, and there was a lady there who was a veteran, and she likes our hospital. And she thinks the VA does a pretty good job.
I think it's a blanket statement that the government should not be in it. What do you say to folks with that regard?
I don't hear that very often, to be honest. I guess I'm kind of the opposite of some people that say they never hear about Russia, and I hear about Russia a lot. but I think that we could reduce Medicare to 55 years of age, and that would be a real help. Most people that get Medicare say, don't touch my Medicare. They like Medicare, and Medicare does work. And if you take out, insurance is expensive because you have to pay the profits that people get. They're public companies, and they get profits for their shareholders, high salaries for their executives, and they advertise. If you can limit advertising, high salaries, ridiculously high salaries, and profits that you give, you've got money that you can put more into health care.
So I want to talk to you about something else, so let's move on also, and let's talk about something else that's been in the news this week. NAACP issuing its first ever travel ban, saying essentially travel to the state of Missouri, especially if you happen to be African American, at your own risk. Do you support that ban? If so, why?
Well, I don't support or not support any bans, but if you're African American, if the NAACP, which is the nation's oldest and strongest and most respected civil rights organization, feels it's dangerous for African Americans, I think that's the reason. Is I think they see danger there. That I think you take caution. You know, a lot of things have gotten strident in this country, and racism and anti-Semitism and homophobia have become more prevalent and more open, and young people see, when I saw the Trump rally yesterday in West Virginia, and I decided that the teams I'm going to pull for this year, besides Memphis, is anybody that plays West Virginia. When I saw those people behind him cheering wildly about not having health care and some young kid, I thought, this is the poorest state in the country, and more of those people get government services than almost any other state. They need Medicare and Medicaid, and they need the Affordable Care Act. They don't know what they're doing.
Perhaps it's just resistance to change.
No, it's a lack of education over the years. They
well,
don't.
You do have a town hall.
We have a town hall tomorrow morning at 10 o'clock at the Burton Callicutt Auditorium at the Memphis College of Art in Overton Park. We're going to have, I'm sure we'll have a big crowd, probably be overflowing. The hall only holds 340. We have an overflow hall which holds about 50. Okay. And I'm going to try to do all I can to interact with as many people as possible. We'll talk about health care. We'll talk about Russia. We'll talk about Trump. And whatever people want to talk about.
Okay, Congressman, thank you very much.
Good to be back with 3.
Always good.